it with Kay and Clay. Kicking it with Kay and Clay. Kicking it with Kay and Clay. Kicking it with Kay and Clay. Hey, what's up, everybody? Thank you for tuning in yet again to the Kicking It with Kay and Clay podcast. I'm your girl, Kay Marie. And what's up? How everybody doing? I hope you are doing really well. Don't know where you are in the world, in the country, because we have listeners from different countries, and all over the United States. But here in Michigan, it's hot. It's finally hot. Now, your girl don't really like too much heat, So, like, I can do today at around 12 o'clock. It was like a good 73 degrees, sunny with a light breeze. To me, that is the perfect temperature. But other people like it like tropical hot, like in the 80s and 90s. I can't when it's a lot of humidity. But I'm so grateful and blessed that it was a good day. And it's going to be hot the rest of this of the week, too, here in Michigan. So you all know that we have different series every month. In May, I just want to bring aware to everyone different awarenesses that are in May. Like we started off this series with talking about lupus. We have Francine on, who is told her story because she is living with lupus at the moment. And then last week we had mental health. It was an episode that I reran because it was just so good the first time. And it's talking about managing your feelings. If you have not seen that or heard that, go check it out. It was really, really good. Because mental health is something that we need to, take care of, just like our physical health. And today we're going to talk about, if you've seen the promo, we're going to talk about hypertension, because May is also Hypertension Education Awareness Month. And a lot of people, especially our people, Black and brown people, living with this, and a lot of times don't know it. So we have a great guest today to educate us about hypertension, okay? And without further ado, y'all know who I do, so I'm about to introduce her, okay? So Julia Echols is a board-certified nurse practitioner who has over 30 years in the healthcare field. See, now we bring you guys people on here with great experience. 30 years in the healthcare field, so she knows her stuff, okay? She began her nursing career at 19 years old through the CETA program to become an LPN, obtain her RN degree in 1991, MSN Family Nurse Practitioner certification in 2016. Her experiences include acute care in the hospital, hospice, medical, surgical, nursing, cardiothoracic step down, transplant surgery, home care, home health care, surgery, home health care, primary care, and family medicine. And she also teaches. We're going to get into that, but without further ado, see that's a lot, and we're going to talk about more of her her education in a minute. So, but I just want you guys to help me welcome to the show a friend of mine. I've known her for a minute, a great while. We used to go to the same church, but we'll talk about that too. Okay, so without further ado, we're going to welcome to the show Julia Echols. Hi, Julia.
Hi, how are you, Kalani?
I am well, and yourself?
I am doing well today. Loving the weather.
I know. So, okay, are you the type of person who likes it really, really hot, or?
No.
Really?
I like you. I like it 70, 75.
Yes.
Breeze. That's me all day.
Yes, thank you.
I like the heat.
Me either. And I prefer, and people look at me with the side eye, I prefer cold more so the heat. Like my favorite season is fall. So
that's me. I'm a fall baby. So I'm all the way. I love it.
Yeah. So like I kind of mentioned briefly, we've known each other for a while now. Mm-hmm. We sang in the choir together. That's how we met. Yes. So that's a while ago.
It's been a minute. It's been a minute. Time flies by.
It does. So not only y'all is she a great nurse practitioner, but she is an excellent singer too. So
thank you.
She sang us a couple of solos at the church and tore the house down. So, so Julia, so it, like I was saying in the introduction here, May is Hypertension Education Awareness Month. And we know that a lot of people are living with this disease, and a lot of people unknowingly living with this disease. Is this what they call the silent killer?
You are so correct. Yes, it's a silent killer because more than half of Americans are walking around with hypertension and they don't even know that they have it. They may put it off as, oh, I had a little chest pain yesterday, or I had a slight headache that just stayed for a while. Those are some of the warning signs that people don't pay attention to. And some people have no symptoms, and the next thing you know, they're in a full-blown stroke or heart attack. So those are things that we want to make sure that, we're educating people about.
Yeah, see, and with the chest pains, I didn't know that. I think I said on one of the episodes that I was diagnosed with hypertension like the latter part of last year, and I had like the chest pains, because that's what got me into the emergency room. Chest pains that wouldn't go away, and found out my pressure was like really high, and went to my doctor, and lo and behold, and I know I put on a couple of pounds, that quarantine, like we were talking offline, that quarantine 15, and hit a certain mark in my weight that I haven't hit before. And even though people would tell me like, girl, what you talking about? What weight? But it's some weight. It's some weight for me. Yeah,
sometimes you can put on fluid. You gain that fluid, and so that fluid, or if you're eating a high sodium diet, or you're just eating foods that are high in sodium, it holds on to the salt. It holds on to the salt, so it causes you to, holds on to the fluid, I'm sorry. It causes your blood pressure to increase too. So that's one of the things that we always educate about, watching your sodium intake, because I was looking at some of the things on some of the restaurants, and these sandwiches that they have, that's your whole or even more sodium than you should have in one day in one sandwich. So you really, really have to be careful with the fast foods and things like that too.
Yeah, you do. And I had to make some slight lifestyle changes. It's still a process.
It is.
Girl, look, I tried to cook. I'm a good cook. So, and I need flavor, so I tried to do like no salt and trying to mask it with other herbs and spices, but it's something about that salt.
Yeah, it is. It's hard to do, but it can be done. I was doing a program and there was no salt except for what's naturally in the food already. It was hard, but I could tell the difference without having the salt. I didn't feel as puffy. Like I didn't feel like my arms weren't puffy. I can tell the difference immediately. So I know that I'm the type of person that holds on to fluid when I eat too much sodium. So yeah.
And that's not good. No. So what is hypertension or high blood pressure, as in layman's terms?
Well, hypertension is what we call high blood pressure. It's the force of a person's blood that exerts against the walls of the blood vessels. So the top number, which is the systolic blood pressure, that is when the blood is actually going through the heart. The diastolic blood pressure is when the heart is at rest and the blood is moving. So that's how we measure the blood pressure, and we measure that in millimeters of mercury. So you may have 180 millimeters of mercury. That's how we do it in the medical terms. So yeah, that's what blood pressure is.
So what's a healthy number for top and bottom?
Well, they want you under 120 for the top number, which is the systolic blood pressure. And then diastolic, they want you up under 80. So, yeah. And we do have stages of hypertension. So there are stages of hypertension. That normal is, like I said, less than 120/80. You know, you get to the elevated, you start getting a 120 to 129/80, anything less than 80. And then they go through stage 1, 2, and 3. So when you get to that crisis stage, that means that your top number is greater than or equal to 180. And then the bottom number is greater than or equal to 120. So that's your danger signs when you're looking at, you know, you can have a stroke, heart attack, things like that. So.
Okay. Yeah, and it's good to, I know for those who are diagnosed with hypertension or high blood pressure, you know, it's good to keep, you know, one of those portable. But how accurate are those? Because I think mine is not that accurate.
Yeah, that's a good question. I always have my patients bring, when they say they have a machine at home, when they come to their appointments, I have them bring it with them so that I can check it against what we have in the office. So we want to make sure that they're taking their blood pressure accurately, because when you do the blood pressures, you're supposed to have your feet flat on the floor, no talking. Your arm that you're going to take the blood pressure in is at the heart level of the heart. So there's different ways to take it to make sure that it's accurate. You don't want the arm hanging down because that increases pressure. You want it right. If you're at a table or desk, you want it right there. So you want to make sure that you're not talking. And people who smoke, you don't want to take your blood pressure right after you have a cigarette, because your blood pressure is going to be up. Because the smoking, it constricts the blood pressures or closes the blood pressures off. So it makes the blood have to force its way a little bit harder through the arteries. So
wow. So I didn't know. I've been taking it with my hand hanging or like on my lap, and that's wrong.
Yeah. If you're at a desk or a table, it should be right there at the heart level. Yeah. So.
Wow.
Yeah.
Okay. And then like the placement, like where on the arm?
There is a artery that comes down. You can see my arm, a brachial artery here. And on your blood pressure apparatus, there is a arrow. There's an arrow there. And you want to line that arrow up right with that artery and then wrap it around. So that's how you should be taking it. People who have larger arms, like I tend to have, my arms are a little bit larger. So they usually will use a larger cuff, because if you're using a normal cuff, sometimes that can change or elevate, make your blood pressure seem higher than it is as well. So you want to also make sure that you have the right size blood pressure cuff when you're taking the blood pressure.
Wow. Okay. Yeah. So I think we kind of touched on this a little bit. So how is one diagnosed with hypertension?
Usually when a patient comes in, their blood pressure is elevated. We usually do it, they have to have more than one reading on 2 separate appointments. So if they come in, the blood pressure is high, you know, I usually will counsel the patient, you know, are you up under any stress? Have you had a history of high blood pressure? Do you have any issues that are going on that are concerning, you know, things like that. And then once I talk to them, I say, well, I want you to follow back up. I want you to watch your salt intake. I want you to do, you know, make sure you're keeping track of your blood pressure. And then when you come back in, which maybe be about a week afterwards, I'll recheck it. Sometimes it depends if it's like super high that day. Sometimes they're going on medication that day.
Oh, wow.
Yeah. And if they're having symptoms. So usually two separate readings on 2 separate appointment days. And that could be a week apart. It could be days apart, depending on the patient.
Okay.
Yeah.
So I have probably like a personal question more so for me. So like, okay, when you're on medication and, you know, your pressure is, you know, stable, normal. I guess that can be kind of false, you could say, because some people might be like, oh, I can go back to eating this and that, and oh, I'm taking the pill. So how does that not work?
It doesn't. And this is something that I go back and forth with patients. Oh, my blood pressure has been fine. I'm like, it's fine because you're taking the medication. So of course it's going to lower your blood pressure. But, you know, if you know that you have, a lot of times when patients have like a drastic weight loss, they've been doing everything they're supposed to do. They're watching their diet and the blood pressure starts to be low. I kind of watch them because I may adjust that medication down. They may be I may be weaning that patient off of their medication because they've gotten to the point in their health where they don't need it anymore. They've lost the weight. They have a better lifestyle. They've made drastic lifestyle changes, so they don't need it, or they may need very low dose. So I'll keep them on it for a while. I'll watch it. I'll wean them down, and then eventually some people can come off of it depending on the patient. Yeah.
Okay. So, but that is a possibility.
It is definitely a possibility. Yes.
Okay. And that's, I think that's good to know, because I don't know about anybody else, but I don't like taking medicine, and I don't want to take nothing, for the rest of my life,
yes.
And I don't want to like depend on something. So I know that for me, and probably for those listening to it, it's just like you said, it's up to that person if they want to make that lifestyle change.
Definitely.
Yeah. So what are before we get into the risk factors, so does genes, genetics, heredity, do that plays a part in it too?
It definitely does. It does play a part of it. Also, our lifestyles, because our families tend to mimic the eating habits of how we grew up, how we cooked certain foods. So that has a huge part to play in it too, because we like our seasonings as African Americans. We love our seasonings. We have to have our food seasoned. So that in itself is a big issue. With African Americans, we have a higher obesity rate. We also have a higher rate of diabetes too, which can affect blood pressure.
Why? This is probably a side note. Why is that we're always leading the charge in the healthcare when it comes to the bad things?
I just think it's just how we grew up. I think it's how lack of education. So education is huge on making sure that you are aware of. And I found that when I talk to my patients a lot, and I sit down and I really explain to them, this is how this works. And if you don't do this, this is what's going to happen. This could be the consequence. I kind of slap them in the face with it. And a lot of times they really get it. They get it. And I'm happy about it, because then it's like a light bulb turns on and they're ready to go.
Okay. So. Yeah, so. I mean, we know that because I belong to a low sodium recipe group in Facebook, so I know that we're not the only ones, Black and brown, who have it. But again, it seems like we're the ones that's leading the charge on that.
Yes. And I was going to go out and tell you a few of the statistics. It says that African Americans, they develop hypertension at earlier ages. 40% of non-Hispanic African American men and women have hypertension. Like I said, due to the higher rates of diabetes and obesity. And then also there's been some research found that there may be a certain gene in the African Americans that can cause more salt sensitivity.
Wow.
Yeah. And, and I was also reading it says an extra gram of like a half a teaspoon of salt can raise the blood pressure like about 5 millimeters of mercury.
Oh my goodness.
And those people that have that gene with the salt sensitivity. Yeah.
So is that something that they just found out?
It was reading some research. I believe it was from 2020.
Okay.
So yeah. So yeah.
Wow. So they're testing for that,
Yeah, they're testing for it. So
wow.
Yeah. So it just costs. It's very costly in the United States. It's been costing like $131 billion each year to treat hypertension. And that's from 2020. Yeah.
Wow. So what are some of the risk factors? Because some people might not take it too seriously.
Yep. Some of the risk factors is family history. You also have age. The older you are, the increased risk, because your blood vessels, they lose elasticity. Gender. They said that men 64 and older are likely to have it, and women 65 and older. Race, which is African Americans. Anyone that has any chronic kidney disease, high blood pressure can result in, kidney issues. Those are some of the risk factors, but there are some modifiable risk factors as well. So we'll go over those too if you want.
Yeah, go ahead. What are those?
So your modifiable things are things that you can change. Some things you can't change, like your genetics and things that you can't change, but increase your activity levels, your physical activity, lose weight, your diet, low sodium diet, drinking in moderation, because alcohol can cause you to have higher blood pressures. Some things like patients have sleep apnea. That can cause your high blood pressure. And that was one of the ones that cause of secondary hypertension, which the hypertension is not the main cause, but the sleep apnea is. So if you correct that, then you can get the blood pressure down. High cholesterol, because the plaques that build up in the arteries causes the blood to have to work harder to get through the arteries. Diabetes, if that's controlled, then your blood pressure can be controlled. Smoking, quit smoking, that decreases the risk factor tremendously. And then stress reduction. So those are some of the modifiable things that you can do for the high blood pressure.
Okay. So for, what are the different stages of hypertension?
Well, like I said before, like the normal stage is the systolic is less than 120 and less than 180 for the diastolic. Elevated, when it becomes elevated, is 120 to 129 and less than 80 for the diastolic. Your high blood pressure stage 1 is 130 to 139. And the diastolic is 80 to 89. Then you got stage 2 is 140 or greater, and then 90 or greater. And then your hypertension crisis is when we tell you, okay, like you need to go to the emergency room like right now. It's greater than 180 for the systolic and then greater than 120 for the diastolic blood pressure. Those are like danger levels.
So what if someone who's, on the medication, but like they have their pressure has been elevated? What are things you can do to like bring it down?
We try medications, and in the clinic, if we've done, like, I start off with one medication, and then if it's not controlling, I'll try and max that one out. Then that's not helping, I go to the second one. Okay. When it gets to 3, then you want to start looking for other things like secondary hypertension, your sleep apnea, any mass on the kidneys. So we start sending them for ultrasound of the kidneys to make sure there's no mass on the kidney that can be causing the blood pressure to be high. And then other things that are going on as far as heart issues. So those are some of the things that we look for if we can't not control that blood pressure.
Okay.
Yeah.
Okay. And so what are some of the pre-existing medical conditions? And I think you touched on a few of those.
The pre-existing is the like your diabetes, heart, family history. I'm just trying to get to my notes and wrote little notes here. Oh, here it is. Yeah, that could be secondary hypertension, like we went over. It could be caused by other things. Sometimes it could be pregnancy-induced hypertension. Some women, they hold on to the fluid, like your body is going through changes. Your blood circulation, you circulate more blood because of the baby. Blood pressure can go up during pregnancy. Some heart defects can cause blood pressure issues, and kidney disorders like chronic kidney disease can cause. Those are some of the pre-existing factors for the high blood pressure.
So like the preeclampsia, so that can be brought on by somebody who hasn't had a history. So that's like an acute condition.
It is, and it is a very dangerous condition for. It could be life-threatening for the mom and the baby. So they really check them. They monitor them very closely during that pregnancy. So most babies are born healthy, but you do have some, like if the mom is having a hard time, that you do want to make sure that they can have problems down the line. The mom can have problems down the line afterwards if it's not controlled. So,
okay. Yeah. And speaking of control, so how do you control hypertension? Now we mentioned, a medication and lifestyle changes, right?
Yep. Control, like you said, the diet, medication, exercise, all those work in conjunction together. There's certain classes of medications that work better for African American patients than it does Caucasians. They have a certain group that work better for them. So like your thiazide diuretics, like your hydrochlorothiazide, that's one that we'll usually start African American person on first. To see if we can get it down. And then if not, then we increase that dose, max that out. Then we go to like a calcium channel blocker that'll help as well. So we can try certain medications for certain people depending on the person, but mostly focus African American because a lot of times we're the ones that are hardest. Some are non-compliant with the medication. You have it on both sides, but in my experience is we're like so hard-headed when it comes to taking medications and making sure that we're making the changes. Yeah.
I know for me, when it comes to taking it, I'm supposed to take it every morning and I don't.
Yeah.
It's not that I don't want, I forget. I've always been not good with that, like taking something.
I always tell my patients to put a timer on the phone, and I
have that.
You get one of those little pill bottles that has a strip. You can keep it and stick it in your purse, just in case you leave out or you don't have it. And I'll tell them, so they're like, "Oh yeah, that's a good idea." So I'll tell them, put your Monday through or Sunday through Saturday, keep it in there, and you'll know, like if you forget, like, "Oh, I didn't take my pills," and you fill it up every Sunday. And then you'll have it right.
I do not want to be that person that have
your pill bottle.
Hey, the Monday through. Oh my goodness! But I might have to do that.
You have to do whatever works. But you're doing the necessary steps. I see you talking about you're doing your exercise and you're eating right, so you're on the right track. So
yeah. I'm sitting up. Like I was telling you offline, I'm sitting up here with all day. I had a migraine. So
did you have your medication this morning?
Yeah, because I had my headache. Yeah, I took it, and if I don't take it, if I miss it in the morning, I do take it when I get home.
And then sometimes the side effects from the medication can be a headache. Most blood pressure medications side effects are headaches. So I always tell patients, like, if you're taking medications, when you get up in the morning, don't just jump up out the bed. Sit on the side of the bed for a minute. Let your feet dangle and then get up slowly, because a lot of times your blood pressure, the pressure shifts in your body when you get up too fast, and it can cause you to have a headache, and it can last the entire day. So
that's good.
Mm-hmm.
I like that.
Yeah.
Okay. So what are some of the, we've talked about the importance of compliancy with treatment. Oh, and why men tend to be non-compliant with treatment. What's that about?
So, in my experience, a lot of men, they don't like the side effects of the medication because it causes erectile dysfunction. So they will most of the time when they come into the clinic, they're coming in for some Cialis or Viagra. And when you check the blood pressure, it's like through the roof. And I'm like, I can't give you that today because your blood pressure is too high. And then once you talk to them and counsel them, you find out, oh, I've been off my medication for 6 months. I don't want to be on that. But there are certain medications that don't cause, erectile dysfunction. So it's important to educate them. Like if you have, if it's causing you to have, ED, what we call erectile dysfunction, then we can change your medication to something else that's not going to cause that. So it's important to educate them because, I'm like, I'll ask them, do you want to have a stroke or do you want to have erection?
Right.
So I do. I'm like, which one do you want? Because if you have a stroke, your quality of life is gone down.
Oh.
But if you take this medication and we switch it over to something that's not going to cause that, then you have a win-win situation. We can still give you the medication if you need it. So
okay, wow, yeah, it is different medications out here that can cause some sexual problems or whatever. Wow.
Women, most of the time the women, they don't take it because they're like, well, it makes me pee all day. I'm peeing all day, and they don't want to take it because it works as a diuretic effect on you, on the body. It pulls the fluid off of you, so you're going to go to the bathroom, more frequently.
Yeah.
I try to educate them to take it as early as possible. If you're going to be going somewhere or getting up for work, take it early. You know, you're going to be up during the day, you're going to be working, you can get to the bathroom. Don't take it at night, because then you're going to be up urinating all night. So yeah.
Yeah. And I've learned I learned a lot of things, but I like when you said that there's different medications geared for African Americans. Because I don't think I'm on one of them, so I don't think.
Yeah. Well, we'll talk offline about that.
Okay. I'm like, wait a minute.
You know, like a lot of times, and there's research on either way. Like a lot of times, I found that patients, when I get them as a new patient, their previous doctor, like African American, they may put them on like lisinopril, which is an ACE inhibitor. ACE inhibitor may not be the drug of choice for African Americans. We start them on a thiazide, unless you have a sulfur allergy, because it does have sulfur in it, the hydrochlorothiazide. So we can put them on something different, but it works better. Research has found that certain medications work better for African Americans than it does the non-African Americans. So that's the ones that we stick with at first.
Okay, so what's the difference? You said it works better for us. So what exactly does it?
It helps to bring the blood pressure down better.
Okay.
Yeah. So.
Yeah, we gotta talk. So what is some of the things, as we wrap up here, some of the things that you want my listeners, whoever might be listening, who have high blood pressure, or who may have be experiencing some of the symptoms that you mentioned, and they're like, let me go get checked out. So what is some things that you really want to get across to everyone?
Well, I want to get across that it's important because it can be controlled with medications or diet or lifestyle. We don't always initially put people on medications. I'll try lifestyle changes first, bring them back in. But the consequences of uncontrolled high blood pressure, heart disease, strokes, things like that. So those are important, because those are things that could be detrimental to your health, and your quality of life goes down. We can control your blood pressure with the medications. You may not have to be on it if you make those changes. Also, kidney disease. Your uncontrolled blood pressure is going to cause problems with kidney. And I always tell my patients, if you have say for instance, your blood pressure is staying high, your heart is working overtime, your kidneys are working overtime, your lungs are working overtime. Just like a car, if your car is working overtime and you're not taking care of it, it's going to break down. So it's the same with our body. If you're not making sure that pressure is staying low enough so your heart can rest and get the adequate rest, it's going to break down. You have to make sure that you're having your blood pressures checked, and you're going for your annual physicals and those 3-month visits that you have. If you have some type of other disease body going on in your body, that you do need to make those checkups. And for men, especially, because a lot of times our men, they don't like to go to the
no, they don't.
And it's so important, if they're on the wrong medications, if they're having problems, to discuss that with their provider, and they can see what other options. There's options out here for them if they're having any problems in the, with ED or anything like that. So I wanted to drive home that point, and just changing our lifestyles. Even me, I know that I have to make some lifestyle changes as I get older. Our bodies start telling us things, and so I'm making necessary changes to get my lifestyle changed as well. So
it's
points.
That's life.
Yeah, it is.
That is life, constant changes. But it's not, it's one thing about the hypertension, high blood pressure, is that it's controllable. It's controllable. And if, like you say, if you work hard enough, you can eventually come off the medication.
Yes, definitely.
Okay, and before we go, I want you to tell everyone about your new training center, your new business.
Yes, my new training center is Valiant Training Center. It is a school for certified nursing assistant training. I also provide CPR, basic life support, and first aid training as well. We opened in May, and we are accepting students. The classes for the nursing assistant is every 4 weeks, and you can call in if you want to. Call by phone. That's 313-766-4042. And the email address is info@valianttrainingcenter.com. And we're open Monday through Friday from 8 until 4:30 p.m.
Yep. And I'll have the rest of the contact information on our page, and I'll also list it on the description when I post it on the various podcast streams, whether you listen to Spotify, iHeartRadio, wherever you listen to podcasts, we're there. So it'll be in the description as well, especially if you live here in Michigan, and especially if you are in Metro Detroit. Because are you doing virtual or no?
We have been approved to do virtual through the state, virtual or in person. The classes, but the state only allows us to do up to 34 hours of virtual training. The total program is 75 hours. So they would still have to come in to do the lab. And then we have a clinical portion where they'll go out to the actual long-term care facilities for 2 days and then do their training on an actual patient on those days.
Okay, that's nice. So, okay, a CNA. So for those who might be looking for, you're younger or you're older, looking for a career or looking for a change. So, they probably like, so is that good money? That's good money, isn't it?
It is. They can make up to $30,000 a year. Mm-hmm. And for someone that's 18 and up, someone that's 18 even thinking about going into healthcare, mm-hmm. It's a good start. I have a lot of my colleagues that are nurse practitioners. They started as CNAs. Mm. And when you're a CNA, you're more apt to get into nursing programs. My goal is to work with some of the schools, because I do have connections with some of the colleges, to try and bridge them over into the nursing program or gear them towards the nursing program, because some people don't know where to start. Yeah. So I want to be able to mentor them, to guide them into the right directions as well.
Oh, that sounds awesome. Yeah, it's like a stepping stone. Like if they want to get to nursing, or you might have been thinking about nursing and you're not sure, and this is probably a good way to test that out, right?
Yes,
mm-hmm. Definitely. Yes. So y'all, if you're in Metro Detroit, just and you have an interest in that, and you want to go to the school, Valiant Training Center, go ahead and go to valianttrainingcenter.com and just take a look. And she's also on Facebook at Valiant Training Center LLC.
Correct.
Yay, all right.
Come on in.
Yeah, come on in. Yes. Julie, I want to thank you so much for coming on. And finally got you on the show for something. I
was like, I'm going to do the show. I know she want me to come on. I'm going to go ahead and do it. I'm really not a public speaker. I don't like it. I like to stay in the background, but mm-hmm. I'm going to push myself a little bit more.
You did very well. Very well. And you gave us a lot of good information.
Awesome.
And thank you so much for sharing just a smidge of your wisdom and knowledge with us.
It's been my pleasure. Thank you for having me. I appreciate it.
Thank you. Okay, everybody. So this was another great episode. Again, get your blood pressure checked. You having those symptoms, like chest pains that comes every now and then, and it's not going away. Headaches and things of that nature. Go ahead and get that blood pressure, because it's not called the silent killer for nothing. Okay. And especially Black and brown, you know how things are for us. And it's just we just have to deal with it and make some changes. Like for real, y'all. It's time to make changes.
Yes.
So thank you guys. You can you guys, whether you're listening to us only on a streaming only audio platform, go ahead and watch us from time to time. We're on YouTube, we're on Facebook, and we're on Instagram, if you want to watch the podcast. And I know there's some other outlets out there that gives you the option to watch or to listen only, like Podcast Addict and others. And thank you, continue to share, continue to subscribe, and we hit another 1,000 downloads.
Woo-hoo.
And thank you so much, you guys, just for listening and sharing the podcast and the episodes, because I love what I do. I like to bring forth different issues that plague us or that would be beneficial to us. I welcome all people, of course, but my heart and my concern is for my people. And I just want to be able to bring people on and have different shows where we can learn some things, and of course we have fun too. So so I'm looking forward to the next week, you guys. And thank you for rocking with us and continue to rock with us. And you guys have a good one, and we will see you next week. Bye. Kicking it with Kay and Clay.